Hello friends, welcome to Oncology Unpacked. Today we are going to talk about very important topic, pathology report. For someone you love has been diagnosed with cancer, you have probably received this document filled with medical jargon. It's filled like a foreign language, words like adenocarcinoma, Ki67, grading, it feels overwhelming, even frightening. But here is what I want you to tell you. This pathology report is not your enemy. It is your roadmap. It holds the answer that will guide your treatment, your decision, and ultimately your hope. Today I'm going to decode it for you simply and clearly so you can face your journey with confidence. Let's begin. A pathology report is created when doctor send a small sample of tissue called a biopsy and examine under the microscope. And sometimes the surgeon send a big surgical specimen. The biopsy answers what type of cancer it is, how aggressive it is, where is it located, how much is the spread, and what treatment we can use. It's not just a medical document, it's the blueprint that helps your medical team to create a personalized treatment for you. And understanding it, that's the first step, taking back the control. You might wonder what happened after the biopsy. Does it give you straight away the answer? No. Let me walk through it. Step 1. Your tissue sample goes into the specialized laboratory and preserved through the process called a fixation. And this keeps the cell preserved. The tissue is embedded then into the paraffin wax, creating a solid block. And then there is a thin slicer machine which created the incredible small, thinner than the hair size of slice. Then the pathologist examine it through the different microscopes. Now every single step is done with the precision and the care because every detail matters when it comes to the cancer treatment. This process can take sometimes several days, so please do not rush to get the answer because accuracy saves the lives. One of the most common questions I hear, if you are going to do the surgery, why you need to have a biopsy first? Here is why. Biopsy answer what we are dealing with. What is it? Small tissue sample confirm if the cancer is present, identify the type, and guide the surgeon if any chemotherapy or a treatment needed before surgery. And then the surgeon gives us an answer if he can remove it or she can remove it. Remove the tumor provides more tissue and the detailed analysis, and it could be a diagnostic as well as therapeutic. But diagnosis comes before the treatment. Even if two people have the cancer of the same organ, for example lung, they might have a different biopsy report. One person could have an adenocarcinoma, someone would have a squamous cell carcinoma, or a sarcoma, or a lymphoma. So that is a variety of possibility based on the biopsy, and then it guides the surgeon if they need to do the surgery and what type of surgery or a further treatment beforehand. Because different type of cancer respond differently to the different treatment. This is why your pathology report is so crucial, and it tells us exactly what we are fighting with. So we can choose the right weapon to fight against the cancer. Now let's talk about the different parameters get reported. Firstly, something called a Ki67. This is a protein marker that tells us how fast your cancer cells are dividing. Low Ki67, when it is under 10 or 20, the fewer cells are actively dividing and the slow growing tumor, and often it's less aggressive. While high Ki67, when it's over 20 or 30%, many cells are actively dividing, a fast growing tumor, and sometimes it's more aggressive behavior. Think of this like a speedometer of the cancer. It helps your doctor to understand the urgency and the intensity of the treatment. But here is the most important things. High Ki67 does not mean hopeless. It means we have to act strategically. Modern treatments are incredibly effective even if there is a fast growing cancer. Therefore, understanding Ki67 is very important upfront. Now let's talk next parameter. It's a grading of cancer. Grade is about how different your cancer cells look compared with the normal tissue or a healthy cells. Low grade means cell looks similar to the normal cell. It grow and the spread slowly. While the high grade means the cell look very different from the normal and it has lost the structure because it's trying to divide rapidly. Think like a star analogy. When you try to draw the star slowly, you can draw the star without losing the structure. But when you start drawing the stars very rapidly, you lose the structure of the star and it looks very distorted. Exactly like that, high grade tumor looks very different from the normal, and it could be a very aggressive cancer. So we match the intensity of the treatment based on the intensity of the disease. One size does not fit to all. Now let's talk about the resection margin. After surgery, there is a one critical question we ask to the surgeon: did we get it all? This is where surgical margin comes into the play. R0 resection means clear margin, no cancer cells at the edge of removed tissue, best outcome and lower risk of recurrence. The surgeon has removed the whole cancer out and there is some healthy cells around it and no cancer cells present at the margin. R1 resection means microscopic residual disease. What it means is that there were tiny little cells unintentionally present at the point of resection. So when the surgeon put a scalpel trying to remove the whole cancer, but the pathologists tell us that there is a cancer cell present at the margin of the resection specimen. While the R2 resection means macroscopic residual disease. What it means is that when surgeon tell us that they could not remove the tumor, mostly due to the safety of the patients. So the clear margin is the goal, but even if margin is not clear, we have an option. Additional surgery, radiotherapy, systemic therapy can address the remaining cancer cells risk. Your surgical team will discuss and guide you best path forward. Now the next parameter I want to discuss is the lymph node status. Now this parameter only valid for the patients who undergo the surgery. Lymph nodes are the small bean-shaped structure that are the part of your immune system. They are also one of the first place where the cancer spread. So your surgical pathological report will include lymph node status. It involved or not involved. Why does it matter? Because lymph node status directly affect your cancer stage and the treatment recommendation and also the prognosis. Some patients, because of the lymph node positivity, they may have to go through the chemotherapy after surgery. This is where the cancer treatment becomes truly specialized and personalized. Beyond the basic pathology, your tissue undergoes specialized tests called ISH, FISH, and many other molecular testing to find out if there is any genetic mutation is there, and it's revealed the options of the targeted therapy in the future. These tests are game changer and they help us to match you with the treatment and the target specific to your cancer, not just any cancer. This is called precision medicine in action, and it's why two people with the same cancer type may receive the different treatment, because we are treating you, not just the disease. This is why your pathology report is so valuable, and I respect and admire my pathology colleague who are the unsung hero behind the scene. I have shown you the example of the breast cancer pathology report. It's required so many different parameters, so it is not a one-day job. It's required a lot more effort in a team. So every piece of information in your pathology report is there to help you, not to scare you, but to give you the direction. Thank you for being here. I will see you to the next video.